health facilities, such as Kisumu County Referral Hospital, Jaramogi Oginga Odinga Teaching and Referral Hospital, have also employed sign language interpreters to offer auxiliary services to deaf and hard of hearing patients. The Ministry of Health also collaborates with the Ministry of Education through programs with local education assessment resource centers. This link county health facilities and people with learning disabilities in the community by providing sign language interpreters. Honorable Speaker and honorable members, in one of the most significant strategic linkages and partnerships in rehabilitative services, the Ministry of Health has partnered with Scale. This is a global partnership for assistive technology, making Kenya the first country to receive catalytic investment from Scale. Scale will fund the government-owned joint investment of $7.5 million spread over 3 years, 2023 to 2025. Part of the most pressing assistive technology needs and interventions targeted are in hearing and communication. This collaboration seeks to have pre-service and in-service training of healthcare workers in sign language, provision of hearing assistive and captioning devices in health facilities to enhance communication with people with hearing impairment, the establishment of the first regional assistive technology center of excellence in collaboration with World Health Organization, and lastly, strengthening of the supply chain of assistive technology and local production of the same. Part 2 of the question, Honorable Speaker and honorable members, the plan for ear and hearing care 2023-2028 focuses on enhancing capacity building and training healthcare workers as one of its objectives, including sign language. Upon graduation, the Ministry of Health will deploy these healthcare workers to public health facilities. Honorable Speaker, the integration of sign language into the curriculum in all institutions offering health sciences is vital in helping build a proficient workforce in communicating with and serving the deaf and hard of hearing individuals. There are 4 speech and language pathologists in the public sector and 6 in training. The ministry has prioritized training of more healthcare workers in sign language, and numbers will improve in the coming years. As you can see, Madam Speaker and honorable members, the 6 and the 4 are not able to be in all facilities within the Republic of Kenya. On the third question, expound on the treatment and intervention options that the government has employed to assist deaf and hard of hearing. Honorable Speaker and honorable members, NHIF covers hearing aids for students in public and secondary schools under the Edu Afya scheme. We also have treatment like hearing aids and Coachella implants, among other assistive devices. Coachella implants are available, which are surgically implanted devices that provide sound signals to the brain for people with severe hearing loss in one or both ears. However,
there is a point of order, Honorable CS, Honorable KJ.
Madam Speaker, I want to just come back in like the Honorable Catherine Omanyo did, just to understand some of this jargon that is being spoken. And I know we have doctors in the house like Dr. Pokose, who can clarify for us whether it is a cochlear or whether it is a cochlear implant. Because a cochlear might be something that we have never heard of or never know what would ever be called a cochlear. We would want to know if it is a cochlear implant or whether it is something else that we do not know of. Thank you, Madam Speaker.
Honorable CS, I will not ask Honorable Member for NDBS. Kindly just go on and clarify along the way.
Thank you, Madam Speaker and honorable members. I think it's an influence of my mother tongue and my inability to be able to say cochlear. So I'm reading it as cochlear, but it is this word that you are referring to, cochlear. Thank you, Madam Speaker and members. So these implants that we are talking about.
Honorable KJ, you're comfortable because if you knew there is a difference, then you know what it means. He's more confused. It is the one, yes. Go on, Honorable C.
Thank you, Madam Speaker and honorable members. These cochlear implants are available, which are surgically implanted devices that provide sound signals to the brain of people with severe hearing loss in one or both ears.